So when we think about the children that we're working with, sometimes we can get really overwhelmed with the exposure to adversity that they have had in their lives, or the experiences that they go back to when they're not in our own classrooms or in our therapy rooms. But what we have to remember is that the science of resilience tells us that there is a lot of hope in our ability to make new connections, have meaningful interactions with kids, and ultimately change the way their bodies respond to those experiences. This is where the whole concept of repetition is very, very important. The first time we make a bid to connect with a child, or we offer them an experience of safety, or we teach them a new coping skill, it may not be easily integrated into their system. We have to remember, if the early dances and the early lighting up of that anterior cingulate cortex were those experiences that were adverse or uncomfortable, we have to repeat new experiences that many times, plus more and more and more. So we have to remember to continue to make bids to connect, to continue to repeat interventions, continue to repeat coping skills, so that kids can ultimately integrate those experiences into their bodies.